According to Harvard Health Publishing, nearly 15% of U.S. adults experience neck pain every 3 months, and for up to 85% of them, it comes back again and again. In this video, we'll break down the real causes of neck pain, what treatments actually work, and when it might be time to worry. Takeaway 1. That neck pain is more likely to return. One of the most sobering facts about neck pain is that it usually comes back. A single episode is often not the end of the story. According to medical data, between 50% and 85% of people who experience it will be bothered by it again within the next 5 years. This isn't meant to be discouraging. It's meant to change your approach. Too many people treat neck pain like a temporary problem. They wait for it to flare up, take some ibuprofen, maybe get a massage, and then forget about it until it happens again. But this statistic tells us we need to think differently. Neck pain should be treated as a chronic or recurring condition that requires ongoing prevention strategies, not just emergency interventions. It's like dental health. You don't just brush your teeth when they hurt. You need consistent care to prevent problems from developing or returning. The same principle applies to your neck. Regular stretching, strengthening exercises, proper ergonomics, and attention to your posture aren't optional. They're essential for long-term neck health. Takeaway 2. You could have a serious neck condition without any symptoms. Now here's something that sounds completely backwards. You can have significant structural problems in your neck and feel absolutely nothing. The perfect example is a condition called cervical spinal stenosis, a narrowing of the canal where your spinal cord sits. It typically develops from a combination of osteoarthritis and disc degeneration. Not everyone with this condition experiences symptoms. Medical experts have found this condition on MRI scans of people who had zero complaints of neck pain. Your spine could be significantly compressed and you might not know it. This reveals something fascinating and a bit unsettling about pain. The relationship between what's happening structurally in your body and what you actually feel isn't as straightforward as we think. Just because something doesn't hurt doesn't mean everything is fine. And conversely, sometimes severe pain can come from relatively minor structural issues. This is why persistent neck pain deserves proper medical evaluation. You can't always trust pain or the absence of it to tell you the full story. If you're experiencing recurring neck issues, proper care and a thorough examination by a healthcare provider can uncover problems you didn't know existed. Takeaway 3. Strained muscle is just the tip of the iceberg. When your neck hurts, you probably assume it's just a strained muscle. And yes, strains and sprains are the most common causes of neck pain. But when pain persists or keeps coming back, there's often a more complex story happening beneath the surface. It usually starts with osteoarthritis, basic wear and tear on your spine. The cartilage that cushions your joints breaks down over time, and without that buffer, bones start rubbing against each other. But osteoarthritis isn't just its own isolated problem. It's often the first domino that triggers a cascade of other conditions. For instance, osteoarthritis is the leading cause of cervical spondylolisthesis. Imagine your spine as a stack of building blocks. In this condition, one of those blocks, a vertebra, slips forward out of alignment. This can pinch the spinal cord and nerves running through your spine, causing pain, numbness, weakness, and even balance problems. Then there's cervical spondylolysis, which is essentially a stress fracture in a specific part of a vertebra. It's often caused by repetitive strain or uneven wear over time, and it's a frequent cause of chronic neck pain. The key word here is chronic. This isn't something that happens overnight. What this tells us is that degenerative conditions don't exist in isolation. One problem feeds into another, creating a domino effect. This is why chronic neck pain shouldn't be dismissed or taken lightly. If you're dealing with persistent discomfort, it's worth investigating what's really going on beneath the surface. The sooner you identify the root cause, the better you can prevent the cascade from progressing. Takeaway 4. The warning signs can be specific and strange. Not all neck pain is created equal. and the specific characteristics of your pain can be incredibly revealing. Instead of just saying, "My neck hurts," paying attention to the details can help pinpoint exactly what's wrong. For example, do you hear a grinding noise when you turn your head? That's a potential sign of osteoarthritis. Those bones are literally grinding against each other because the cartilage cushion has worn away. Does your pain actually get better when you bend forward? That's a classic clue for cervical spinal stenosis. When you bend forward, you temporarily create more space in the spinal canal, which relieves pressure on the compressed nerves. Or maybe you have shooting pain that makes it hard to perform fine motor tasks like writing or buttoning your shirt. That's telling you that a pinched nerve is interfering with the signals traveling to your hands and fingers. The nerve responsible for those precise movements is being compressed somewhere along your spine. These aren't just random symptoms, they're diagnostic clues. They're your body's way of telling you exactly what's going wrong and where. This is why it's so important to be specific when you talk to your doctor. Don't just say you have neck pain. Describe when it hurts, what makes it better or worse, and any unusual symptoms like grinding, numbness, or weakness. How to relieve neck pain. Neck pain can last for weeks, months, or years. The time it takes to heal depends on many factors, including the cause, previous neck injuries, a person's age and general health, and which treatments are used. The goals of treatment for neck pain include relieving pain and restoring function. For pain relief, your doctor might suggest rest, ice, heat, over-the-counter pain relievers, and avoiding quick movements. A foam cervical collar used for the short term also can help rest the neck muscles. To restore neck function, common treatments include physical therapy, neck stretching and strengthening exercises, shoulder strengthening exercises, therapeutic ultrasound, which converts sound waves into heat that penetrates into deep tissues, use of a neck pillow that supports the natural curve of your neck, TENS, transcutaneous electrical nerve stimulation, which delivers low-voltage electrical currents at or near your nerves to block or change your perception of pain. Traction, in which a physical therapist uses hands, weights, or specialized equipment to create a sustained pull on the neck in order to make space for a pinched nerve. Neck pain is a complex issue with a high rate of recurrence, multiple potential underlying causes, and even silent conditions that produce no symptoms at all. The specific nature of your discomfort, from grinding sounds to how certain movements affect your pain, can tell a detailed story about what's happening in your spine. If you found this Harvard-backed guide helpful and feel more informed, hit that like button and subscribe. Thanks for watching.